Hi everyone, my name is Kristen Neeson, and this is my presentation on our comparison paper, United States, and I chose North Korea. So United States is a highly advanced industrialized country, and North Korea is the complete opposite. It is poverty-stricken, a failed communist country. The United States is a somewhat open book of knowledge. You can pretty much find anything that you need in the library or on the internet, but North Korea is known for their secrecy. So you only really hear things when a refugee gets through the demilitarized zone or reports get released through the news and the White House and government on different aspects, but not a lot is known about their healthcare system. So I had my work cut out for me. So our system is complex, misunderstood, and has gone wildly out of control in the spending. While North Korea's healthcare system is known as a free system, but it lacks the basic necessities and is completely failing. So my presentation starts with a little background information on the United States. We are one of only few developed countries without universal health care. In 2014, the United States spent $2.9 trillion, which came to $9,255 per person on health care, which was 17.5% of our gross domestic product, and it's estimated to go to 19.3%. And just to define health, it's the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So the next slide, it just gives some important dates. 1700s was training under one physician, which was common until hospitals were founded. I found a little picture of a pest house, which were created to separate the diseased people from the healthier people, so it wasn't to spread contamination. My next slide gives a little more information, talks about the American Medical Association was founded. In 1910, formal education was attributed to Abraham Flexner, who wrote an evaluation about the medical schools, indicating how substandard the education was. So it kind of made them beef up their education standards. 1930, healthcare industry was mainly men, and they were paid personal payments. There was no health insurance yet. But in the 1940s and 1960s, the group health insurance was offered, but it did change the relationship between the patients and the physicians, because now they had that third-party health insurance company in the middle, instead of just handing the doctor your money. Next slide is in 1965, the Congress passed the Medicare Act. So this was intended for a much smaller population base. Around that time that it passed, there was only 8% of the population was elderly and needed the services. Now it's way past that. So the Medicare and Medicaid system are failing, and they're going broke. So it was intended for a much smaller population base. They did not expect or plan on that growth. It focuses on specialized hospital care instead of concentrating on community-based primary care, and that's more something that I found more now, not back then. There's 3 parts to Medicare. There's Part A, which is the hospitalization treatments. Part B is the physician tests, visits, and any procedures done by the physicians. And then Part D is the prescription drug coverage, which was also underutilized. Well, not underutilized, but they didn't expect it to be as big as it is. Like, they've already spent like $19.6 billion on this program, and they did not expect to spend anywhere near that. So 1970s and 90s, the patient dollars surpassed research dollars at the largest source of medical school funding. Our next slide talks about the Affordable Care Act. So this was passed in 2010 by President Barack Obama. Some of the pros was it was supposed to have lower premiums. It concentrated on preventative care instead of treatment of disease. It allowed children to stay on their parents' plans longer, up until 26 years of age. It had tax incentives for businesses and consumers. It helped slow the cost of health care, and it eliminated denials for pre-existing conditions, which is huge, because insurance companies could say no if you had a pre-existing condition that they didn't want to handle. Some of the cons was there was no penalty. There was a penalty for not purchasing health insurance. So at the end of the year, if you didn't have health insurance for a certain amount of months, you were fined, and it was taken out of your taxes, your refund taxes. So insurance premiums actually increased, income taxes increased, and pharmaceutical companies paid billions in dollars in fees, and that was passed on to the consumers for price increases in medications, medical devices, and supplies. And then many are still uninsured or underinsured. So it has some work to go. My next slide is about women's rights, where women lack the basic coverage to health care, which includes like preventative treatment, maternity care. We have a pretty high infant mortality rate, much higher than the Western worlds like Switzerland, Finland, France. And our employers are not always obligated or required to provide birth control coverage. So in one of my previous classes, we had to do an interview, and I actually interviewed the physician that I work for, who is an OBGYN, and she stated that she feels a lot of these numbers can be attributed to educating the community more, because that infant mortality rate comes into play with patients who don't go and get maternity care until later into the pregnancy or at all. So, which can be, preterm delivery, or the baby isn't quite healthy because the testing that wasn't done. You need certain things throughout your pregnancy to have a safe pregnancy. Like if you're Rh negative, you have to have RhoGAM injections. And, someone who doesn't go to the physician or comes to the physician later in their maternity care, they're not going to know that. So it's partly education. So now we're going to go into North Korea. So the Korean Peninsula, or known as the Land of Morning Calm, was broken apart by the Korean War. So there was North Korea and South Korea, which is separated by the demilitarized zone. North Korea is run by communist dictatorship, currently Kim Jong-un, who you will see in the picture. He has now made this hairstyle a requirement for all men. They must have that hairstyle. Okay, the North Korean healthcare system. So they did have a free healthcare system. It was signed into law. It was the Social Insurance Law of 1947. It provided healthcare for workers and their families, and it was not known to what extent the program reached, but a lot of refugees expressed appreciation for the system when it was there and available. The goal was to establish free healthcare system by 1960, and it was access to physicians anywhere. Like the different villages had primary care providers that would come and go to, your home if you had a cough. And there were special programs for maternity care, access to preventative medicines, medications, and access to hospitals. So there was 4 levels to the healthcare. There was primary care, which involved healthcare and emergency care offices along with primary hospitals. There was second level care, which included county level hospitals. Third level care, which included university hospitals, and fourth level, which was specialized hospitals. There was great pride in their healthcare system, and it was highly emphasized on education and dedication. And they started to deteriorate around the 1980s due to limited access to basic medicine and equipment, which because of the political isolation that the dictatorship put the country into. The healthcare system did eventually collapse with the famine in the 1990s. So next slide. It's not a nice picture. So like I said earlier, North Korea is only 20% farmland. The other rest of the country, 80%, is dense forest and mountains. So there's no room for growth agriculturally. So they experienced a heavy monsoon season that flooded a majority of this land, and it destroyed their rice crop. It's directly responsible for an estimated 2 million deaths, and there was no access to basic medicine beforehand. So now these people are malnourished, their immune systems are suppressed, so they were more susceptible to disease and illnesses, which caused a lot of deaths in the healthcare workers as well. So they were sparse for those resources. And then the famine, combined with the failed economic policies and international isolation, destroyed the system. So now the healthcare system, it's basic stuff in the capital, and they make it in the capital so when someone comes over and gets sick, they can highlight and show how amazing it is. There was a journalist who went over there. He got sick, he got dysentery, He wasn't at the Capitol, but he was close. He ended up having to travel 30 minutes to get to a medical facility that doubled as a bar. And he was treated. He was given IV porridge and tea, and then the next morning told he had to go. So that was his Capitol, experience with the healthcare system. And they show foreigners the best of their healthcare systems. There was another where they brought in all of these people to show them their state-of-the-art maternity hospital, and it was so cold that people were wearing hats and gloves and doubling up with scarves and blankets, and it was bad. They had equipment from the Soviet Union era, where, back before the Korean War, that's who took care of them. So they still had that equipment there, and that was in the Capitol. So some of the North Korean defectors, on my next slide, that they caught, they were stunted growth. He was 24 years old, and he was 5'5" and weighed like 123 pounds or 25 pounds, which is, significantly smaller than his southern partner in South Korea. They were underweight, they had uncooked corn in their stomach, they were full of parasites and worms, and they had a weakened immune system. So because of the famine, and because of the political isolation that North Korea has provided for themselves, they expect another famine to happen pretty soon. Because now with everything else going on, the unsanctioned nuclear program, a lot of their aid has been cut. So United States and Canada actually used to send a lot of food aid to them, and because of everything going on, it's been drastically cut, if not eliminated, from many countries. So it's kind of sad to see that the country is going through that because of the dictatorship. It's not the people. But they can't express that because then they'll die. They'll be killed. So my next slide is a couple stories that I found from refugees being interviewed. So one woman had to have an appendectomy, her appendix removed, and there was no anesthesia. She was strapped to a table where her arms and legs were tied down so she couldn't move, and had the surgery performed right then and there. Another refugee stated that you can go to a hospital and it's free to still go and be seen, but there's no food, there's no bandages, there's no medicine, and there's IV fluids, but if you need IV fluids, you have to bring your own bottle. They prefer beer bottles, and if you need more than one, then you need to bring more than one beer bottle. Physicians are not paid a salary, and you barter with alcohol and cigarettes. But another report that I read said that they are now charging people for their services, and if people can't pay, then they're turned away. So because of this, many people are treating themselves with something known as ice, which is a highly addictive methamphetamine that's being reproduced. So that's all of my slides. I'm just going to sum it up with my paper's summary. The United States healthcare system is complex, misunderstood, expensive system that is in need of major reform. The United States spends massive amounts of money on healthcare for citizens, but we're nowhere near the healthiest people in the world. We're trying to make those changes today with health reform and provisions of the Affordable Care Act. And I think, all of these GMO foods and all of these health food stores and organic, farm stands that are popping up are going to have a huge impact on that as well. But while our federal government is in serious debt, our elderly population is basically covered for their healthcare needs, and women's rights are slowly coming out of the darkness. So we need a system where everyone is given the opportunity to have equal healthcare and affordable healthcare. Excuse me. And it's not at the extreme cost that it is today. So my comparison, North Korea has been plagued with a series of natural disasters that has destroyed the farmlands. North Korea, which I kind of found interesting, is only the size of Pennsylvania. I thought it would be much bigger, but it's only the size of Pennsylvania, and it's home to an estimated 22 million people. They look for a hope of reintegration of the communist North Korea and democratic South Korea to be a democratic state. So they are taken care of a lot better. While South Korea is a thriving nation with rich infrastructures and a booming economy, North Korea is deteriorating rapidly. Until the political power that controls the everyday single moments of the North Korean people are taken from power, there's little to no hope for the health of the people, unfortunately. So that is my presentation, and thank you for watching.